we're going to talk about NCD, and many of us don't even know what are NCD.
A child who may be living with a non-communicable disease may have that extra burden or need that extra attention to be able to think confidently about herself.
A lot of people think that NCD only affects the adults, but not the children or the adolescent. What do you think about it?
Two things I would say. Non-communicable diseases has first children onset. Adult non-communicable diseases can often be reduced, prevented early in life.
Hi, my name is Aakriti, and today we have Cynthia McCaffrey with us, who's the representative of India, UNICEF.
I'm very excited to talk to you about non-communicable diseases.
Yes, today we're going to talk about NCD, and many of us don't even know what is NCD, and then especially how it is affecting the children and the adolescents. So today we will cover all those areas, as most of the people are nowadays living a lifestyle which is not suitable. Of course, it is actually leading us towards NCDs. So what are the risk factors which you think are responsible for NCD?
It's an issue a bit of making sure that we have this equitable right to health, quality health for everyone.
Yeah.
85% of premature deaths that are happening due to non-communicable diseases are happening in lower middle income countries. So in those countries that have more poor populations, harder to reach populations. So that's another issue in terms of how do you make sure you address non-communicable diseases, is looking at creating quality health care that are consistent across all populations.
Yeah.
Shouldn't be dictated by where you were born if you're in order to get access to insulin, for example. So I think one of the key things that UNICEF is doing with partners, with governments like India, is continuing to invest in primary quality health care. Because if you can reach a child with basic health care, you can reach her with those early diagnosis,
Yes.
and then you can refer her to get the treatment that she needs through life.
Right.
Then the second is building on things like what we're seeing in India, which is Fit India,
Yeah.
and really enabling people to understand a healthy lifestyle can create a healthy life.
True.
And so things like looking at your diet, knowing what's in your food,
Yeah.
Labeling. We're working with industry to make sure there's labels on food so you know what you're eating,
Yeah.
to have good nutrition. Thinking about being active
Right.
and being able to play, being able to be in sports. And that, in starting that early on and working with governments to have that information shared, those initiatives and schemes rolled out through schools, through community centers, through local governance systems, all of that enables kids, parents to have that information and then do with it what they can and will.
Right. What is the significance of NCD week, which was just celebrated?
So I would say three things. I know we're coming toward the end of the week, but I'd say first and foremost is non-communicable diseases represent 74% of global mortality, of global deaths.
Yeah.
So the first point is it's a burden.
Yeah.
So taking a week to take a look at that disease burden on the world. Mm-hmm. The second is bringing attention to the fact that it impacts children.
Yeah.
And we can talk more about that, but we talk about non-communicable diseases, and UNICEF says the C also stands for children. There's an important set of actions, awareness that we can take to make sure that we address and improve children's lives. And then the third is we have momentum.
Also, a lot of people think that these diseases, NCD, only affects the adults, but not the children or the adolescent. But what do you think? What do you think about it?
So I think two things I would say. So non-communicable diseases has first children onset.
Yeah.
So that is diseases like sickle cell anemia, type 1 diabetes, and that impacts a child early in life, or it can, or when they're younger. And that requires information, knowledge for a parent to be able to understand that there may be symptoms that they have to examine. Frontline workers having the capacity to be able to say, wait a minute, there may be something else going on here, and often has to refer them, but be able to refer them quickly. So those children's onset non-communicable diseases requires our attention to make sure you can identify, diagnose, and then children can live with access to quality, regular, consistent insulin for type 1 diabetes. So that's the child onset. Adult non-communicable diseases can often be reduced, prevented early in life by saying to a child, healthy diets, healthy lifestyles, exercise, by being aware of that healthy lifestyle and what it takes to have a healthy lifestyle. And that means as you grow older, that you won't have those things like hypertension that we often see, or type 2 diabetes that will often come with weight. Or so it is about children, and even if you're an adult, we can give you the knowledge and the habits to start living and eating healthy from early in life.
And also, I think there's a lot of stigma, especially when it comes to NCD. How do you think that the mental health of children is affecting this?
So I would say, first and foremost, every child will struggle or has to pay attention to his and her mental health. And as you're growing up and you're changing, it's completely natural for a child to be struggling with how does she belong and what should he do and all of that. So that is something that we are working across the world, UNICEF, but with and in India as well, to think about the mental health of every child. A child who may be living with a non-communicable disease may have that extra burden or need that extra attention to be able to think confidently about herself. So I would say, number one is knowledge and information for everyone. That a child with a child onset non-communicable disease is understanding that they can live and are living a healthy life with access to consistent, regular health care. Secondly, they have every right and desire to play and to be in sports and to be a part of conversations and parties and things like that. And so I think knowing and understanding that first and foremost, every child is a child no matter what. And then secondly, enabling everybody, once you know that, that everyone has that right and desire to play and to be a child.
You actually mentioned a very great thing. The people around should be more, conscious about such children. And how is UNICEF working towards it on a global level?
In terms of addressing,
addressing the
non-communicable diseases, I would say we're trying to do 3 or 4 things. And number one is bringing children to the center. So non-communicable diseases, one is you can take care of children and give them and their families a productive, stable, happy life with that consistent care that they need, that early diagnosis. You can help with adults preventing it by giving the information, again, working early in life on healthy diets, healthy lifestyles. So number one is putting children at the center, because either way, we're helping children through early in life or helping adults while they're growing up to be healthier. The second is that equity is really working with governments to make sure that the systems reach in a quality way, quality systems wherever a child is born, wherever that child is living. And so strengthening those systems. The third is working with governments, with decision makers, to make sure that they're financing the systems, making sure that they understand that their investing early will make sure a child who has onset non-communicable diseases have a healthier life, have a longer life, less time that they have to be in medical care. Investing early with that information and a strong system, and making those investments now for a child means that you may have less adults who you have to care for later. So it is really looking at putting the child center, making sure that you've got equity systems that reach, and making sure that you have that financing that enables that investment. I would go even further to say, by doing all that, you give people information, including addressing stigma, so that a parent knows and understands what's happening in her child's life, but also may know and understand what's happening in a classmate's life better. So I think that also then creates and has an incredible dividend that we don't even necessarily are able to measure.
Is it curable, NCDs? Are they curable, or we need to, look it through the start? We have to look at the children first. Or is it curable at the higher age also?
So at an older age, it is definitely preventable. So for the most part, a lot of the NCDs that we see in adult life are preventable from looking at that healthy diet. And it's hard to change your diet habits.
It is.
It's hard to change your lifestyle
Yeah,
habits.
right. True. Who all need to come together and help. I mean, of course, it's not a job of a one person or a one community, but everybody has to come together.
Yes, I love to say it, but everyone has a role to play.
Yes.
Number one, everyone can know and understand what non-communicable diseases are. So just if you're listening to this podcast, there's wonderful websites. You can go to see UNICEF, you can go to the UN website, and there's all kinds of information. So everyone know and understand, because then you'll appreciate what people may be going through.
Yeah.
It is knowledge and information at the health sector level. So making sure that your frontline health worker and also your doctor at the place where the child is born, that you're able to have that knowledge that says, wait a minute, let me see how if there's a child that's struggling with something, it may need that diagnosis that you may not think of naturally as you're watching a child grow. That information also is important for a parent or a grandparent who maybe, if a child is not well, young, you think through, oh, maybe we need to get some help. And so the parent asking questions, the grandparent, but also the health worker, government, private sector. Government create the systems, they make the investment. Private sector employs a lot of people. How do they make sure their employees know and understand
Yes.
and invest in sharing this type of information, making it accessible so people know and understand, share tips and tools, sites that enable them to know what a healthy diet is, what a healthy lifestyle is, taking time to exercise. All of that from private, public, being at home, we can all remind each other and help each other to do it.
Yeah. Our society needs to know that NCD is a silent killer, and we all need to work together. But thank you so much, Cynthia. It was an amazing conversation, and you gave us a lot of insights. And thank you so much. Let's move forward with a positive attitude, and let's have a better future for our children. Thank you so much.
Thank you. Thank you so much.
Thank you.